The Link. Set into the KUAM News Link Zoom room where we have standing by the acting interim chief medical officer for the Department of Public Health and Social Services, Dr. Robert Leon Guerrero, affectionately known as Dr. Bob to many. Good morning, Doc.
Morning.
Good morning.
Congratulations.
Yes. Thank you.
You sound so excited.
Yeah, I'm excited, all right.
Well, I guess we'll start. Go ahead.
Just saying that I accepted the job because I wanted to make an impact, especially during this time of COVID-19, or more of an impact. Excuse me.
Yeah. Well, we'll just start there with the first question. What type of impact do you feel that you're going to be able to make in this new position?
I'm actually still getting my feet wet in what the job entails. I mean, there's so much things to be done even before I accepted this. Every morning, I go head up to Teason and help with the getting people who are COVID positive into treatment centers like the Regeneron Center over at and then in the afternoon I'm there. So it really doesn't leave too much time during the day. So I'm only now trying to learn what the job entails, and it's a pretty daunting job, but I think I'm pretty sure I can do
it. If you could maybe describe the responsibilities and duties of a chief medical officer for the department.
Well, again, I'm still getting my feet wet into this job, but what I've learned so far is that I need to make out scenarios of how to take care of different problems especially with the COVID-19. I think on Friday night I spent maybe about 6 hours from about 5 to 11:30 getting a lot of these memos written out. How to test at the schools, the medical exemption letters. Again, that's why I say it's a pretty daunting job.
Right. Yeah. Wow.
And I'll learn more once I get my feet more into the water.
Are you able to speak about the booster shots? And when we had Janella on yesterday, she was mentioning that the VA, PPC, CCP group was supposed to meet yesterday afternoon.
Yeah, we didn't. But so first of all, there actually is a third shot available already, right. And that's to give to the people that are classified as immunosuppressed. These are people that may not have responded to the first or second. That's why the third dose. So it gets a little bit confusing because like I said, we've already started giving out that. The next step is to give boosters to people at risk. Those that are over 65, healthcare workers. And we basically follow the CDC guidance. So FDA approves it, CDC approves it, and then we meet and try and make it an action item. The problem with this booster shot initially was that it wasn't going to be given to healthcare workers who are at risk. And at a later meeting, the CDC did add that to its recommendation. So it wasn't as smooth a transition as we hoped to be, but my guess is that maybe later on today we'll meet or and then make it okay to start giving the booster shots.
Doc, what does that mean for individuals like for myself, for example? We took the shot in March, second shot in March, and now we're seeing, as you just said, that they're not allowing boosters for us regular people, just for the frontliners and the Bonamco. So what does that mean for our protection against the virus as we move further down the timeline?
Well, the vaccine is pretty effective, and for people like you, the likelihood of being immune or helping with avoiding serious complications of COVID-19 is much higher than the group that we're trying to target. The group that we're trying to target, their immune system maybe not work as well, so they need a boost into their immune system. Whereas people like the 12 and above population, their response to the vaccine was a lot better than, like, say, people my age or older. And so that's why we want to target them first. The likelihood of somebody your age getting severe COVID is if you got the vaccine, and that's that point. If you got the vaccine, the risk is much, much lower. Not zero, but lower. And so we want to target the people that are more at risk initially, and then because we probably can't do everybody at one time. If we try to do everybody at one time, the people that are at risk are not as it's not as easily accessible to them. So we want to do it in a logical, stepwise fashion. Get the people that are more at risk, then followed up with the people like you that are most likely immune to the virus.
Can you kind of go in, Doc, and maybe give your explanation? Because I know we had asked your predecessor this question, and I think he had said it was a valid concern, but other than that, didn't really address it much. And just kind of talking about these so-called breakthrough cases, right, where you have individuals who are vaccinated but still ending up in the hospital setting. Right, and so when we look at the breakdown, it's like 37 unvaxxed, 27 vaxxed, right? So what do you kind of make of those statistics? Because it seems like the higher vaccinations we get, the more vaccinated people end up in the hospital. And then you just said that
Sorry.
You just said someone like me, for example, should have pretty good protections against the virus. When I look around and I see many of our vaccinated brethren and sistren ending up in, the hospital, it's just a little hard to understand.
Well, if you look at the numbers, first of all, if 80% of the island is vaccinated, and let's say the population of the island is 150,000, so that's about 120,000 people that are fully vaccinated and 30,000 people that are not. So if you have a case scenario where you have 40 people in the hospital, 25 are unvaccinated and 20 are vaccinated, you're looking at 20 people out of that 120,000 versus 25 people out of the 30,000. So the ratio, the actual incidence of severe disease in vaccinated people is so much lower than are unvaccinated. So you got to compare apples and apples and not oranges to oranges. I mean, if you just look, if there's more people that are more people that are vaccinated and less people that are unvaccinated, you still have more people. I mean, if the vaccines didn't work, then you're looking at a rate that's, if you have 25 out of 30,000 that are unvaccinated, you're looking at a much higher number than this 20. So it does work. There are going to be, it's produced by a man, and men are definitely not perfect. So even the previous other vaccines that we have, that the ones that we have children get, like the measles shot, the tetanus shot, they're not 100%. And that's why we give boosters. Like the tetanus, we give the booster at middle school and 10 years every 10 years afterwards. So we do know that it's not going to be perfect. And that's why they also not just look at vaccinations, they also try to make sure people follow simple measures like wearing a mask, social distancing. I mean, that thing works as well. And then, of course, those that do get infected, we're trying to get them the Regeneron before they get seriously ill and get admitted or present to the hospital DOA. So we don't have one particular ammunition for fighting COVID. There's multiple, because we do know that nothing is perfect, and so we need some backup in case there are breakthroughs. But again, if you're looking at how many vaccinated people get sick out of 120,000 versus how many how many vaccinated people get sick out of 120,000 versus how many people that are unvaccinated and get sick. I mean, the data just shows that it's so much better to be vaccinated. But you still need to, because there are breakthroughs, you still need to wear your mask. You still need to practice social distancing. You still need to wash your hands. And that's actually for not just the COVID-19, but other viruses. Now that we're starting to pick up on travel, people coming in, returning, we're starting to see more of the viruses that we normally see before COVID came. And we're not, unfortunately, we're not seeing it right now as bad as what we had in the past. I mean, flu, for instance, our flu season last year was minor compared to what it was in the previous years because people were doing the smart things, the wearing the mask, social distancing, hand washing. So that still needs to apply even though you're vaccinated.
I wanted to just go back to the booster shot and the VA PPC and the FDA and the CDC saying this could go to 65-year-old individuals, others with pre-existing medical conditions and high-risk work environments. This is just for Pfizer, but say that someone who fits within this category and this criteria, they got Moderna. Can they go and get the Pfizer booster?
Theoretically, they can, but they right now, when you mix the two, you tend to have more side effects when you mix them. Moderna, just like when we first had vaccines approved, Pfizer was the only available vaccine for at least, I think, if I remember correctly, about a month before Moderna was able to be given. So you figure that the recommendation is 6 months after your last dose. So Moderna probably, if you're going to get a Moderna booster shot, it should be 6 months after your second dose, which falls about the same timeline as the Pfizer. It's just since Pfizer started earlier, there are more people with the Pfizer that can get the booster shot earlier because it's recommended, I think, 6 months after your second dose. Mm-hmm. The other thing is that there might be some, there's some studies that are starting to show that Moderna actually put more of the mRNA into their vaccine. So that's why they tended to have a little bit more minor side effects, but that overall, their immunity may be a little bit longer than the Pfizer, but you're looking at, very small time frame, like maybe a month or so. So I still would recommend that if you got the Moderna, wait till the Moderna becomes approved for a booster, because again, most people who got the shots got their second dose in January, and that was Pfizer. I think Moderna, most people who got their second dose was probably in March, and 6 months later, the timeline now.
When will the VAPC be meeting?
My guess, and I don't know that for sure, but my guess would be today.
Okay, and then I guess after that
meeting,
it
just takes us to look at the I'm sorry.
Oh no, I was going to say, and after that meeting, then we'll probably see something in the JIC report about the third shots.
Yeah, but we're anticipating that it's going to be, so we started ordering more vaccines to be given. To be mailed to us. We're also making sure that we have adequate supply in anticipation of the what we hope would be a huge uptake of vaccines in the next weeks from the people getting a booster shot.
Mm-hmm. Could we talk about whether or not public health has received any more results from on variants? It's been a while since we've.
That's part of the thing that I haven't got information on, so I can't really give you any information on that. So, again, I just started this job last week, and I'm starting to learn more and more of what it entails, and I'm sure that is important information, but at this point I don't have that information available.
What about RegenCo V and how operations have been going at the infusion center, and what's been the response?
Well, initially it was slow. I mean, I think the first day that we opened up the Manila Senior Citizen Center was maybe about 4 or 6. Yesterday, in the morning, we were up to 16 being given that day, and I foresee that that number will continue to rise. In the meantime, we're both Dr. Cruz, Luis Cruz, and I operate the clinic here. They're going to be phased in, and we can then do other jobs that are just as important, and FEMA can take over. So we're built to, are designed to give at least somewhere between 40 and 80 per day.
Has there been anyone that's experienced any sort of adverse reaction? Because I remember hearing Dr. Cruz, he said there's like an hour monitoring period after the treatment.
Mm-hmm. The reason is we do that is because we don't know what if there's going to be allergic reactions to this medication, because this is such a new medicine, and we don't know if you're going to be allergic or not. So that's why, similar to the vaccine, we watch people to make sure there's no severe adverse reaction. And in as a preparation, we also have medications to respond to allergic reactions. So the monitoring is mainly because of making sure that these people are not severely allergic to it. Minor, I mean, one, it does hurt. I mean, it's a shot. Well, I'm surprised that most people, when I ask them how does it feel, they say, oh, just a little sting. So it's not, and they're coming there thinking it's going to be the worst pain that they're going to have, and yet afterwards they said it's not as bad. So we call, Dr. Cruz calls up the next day, asks the people who received Regeneron how they're feeling, that they had any major side effects that they need to go to the hospital for. And so far, the answer to that is 0. And most people, if not all, have said that they started feeling better that night, definitely by the next day. And that's one of the reasons why we want to give it, is to make them feel better sooner, but more importantly, try to prevent hospitalization and the DOA scenario.
And the RegenCov, that's primarily for unvaccinated COVID positives?
It's mainly for people that are at risk. And one of the risk factors is being unvaccinated. But if you're vaccinated and you have things like diabetes, you have immunosuppressive disease, you're over 65, you have high blood pressure, you have lung disease. So whether you're vaccinated or not, it's meant for you because you're at high risk, so we give it. But yeah, vaccinated people tend to be at higher risk.
Vaccinated? Did you say?
I mean, I'm sorry. Unvaccinated people tend to be at higher risk of developing serious complications from COVID-19.
So if I'm unvaccinated and I got the RegenCov treatment, how soon after, if I wanted to get vaccinated, could I? Is there a time frame that I have to wait?
Yeah, we set the time frame for 3 months. The monoclonal antibodies are antibodies to COVID-19 and anything of COVID-19. So if you give during the time that you receive the monoclonal antibody, the monoclonal antibody doesn't know that this is vaccine versus disease, so it will try to eliminate it. So then your immune system doesn't get the effect of the vaccine. So the recommendation is 3 steps to the safe side before you can get the vaccine.
Mm-hmm.
And we do recommend it, even if you're sick and you got COVID. We still recommend it.
I wanted to get your take. The governor, she's been quoted in the paper saying that looks like the numbers that we've plateaued, right? But yet we just saw 8 deaths last night. We still see triple-digit positive cases, hospitalizations, 50, 60, 70s. Yeah. Have we plateaued? I mean, how concerned?
You got to also remember, even in the beginning, you get more people getting COVID-19 infections. It takes somewhere between 2 and 4 weeks before you start seeing the major effects of it, like the hospitalizations and death. So even though it starts plateauing, you're still going to have the hospitalizations. You're still going to have the deaths because you still have those people that are infected. So it's going to take maybe about 2 to 4 weeks before we start seeing less hospitalization, less death, and with the Regeneron, hopefully we can see that a lot sooner because with the Regeneron, we're trying to decrease the amount of hospitalizations, decrease the amount of deaths. So whereas before, when we didn't have anything in our ammunition to take care of COVID, we now have vaccines, we now have the Regeneron. So hopefully it won't last as long. But you know what I've learned with this COVID-19, it wants to live. I know keep changing as long as people still get infected. So I can't really stress enough. Please wear your masks. Please social distance. Please wash your hands. Please vaccinate.
Doc,
that would get us out of this quandrum a lot faster.
Right. I just wonder what do you see, as the acting interim chief medical officer, and not just in this position now, but you've been in this fight. I mean, you were the first guy to get vaccinated. So I think when the people of Guam, they look at these numbers and they hear things like get used to it or we're plateauing, or they see these policies that are unevenly applied against the unvaccinated, but they don't see a downward trend in the numbers. They don't see a downward trend in the deaths. What they see when they look at this is, well, I think a lot of them think, why aren't we doing anything to stop these positive numbers? So, maybe you can put your doctor hat on and explain to the people of Guam why this is okay, why it's acceptable to have these types of numbers, these types of deaths. More importantly, I mean, God, 8 deaths? Really? In 9 weeks, Doc, 9 weeks of this. Please explain to the people why it's okay.
Well, first of all, it's not okay. Deaths, hospitalizations are never okay. And we got to get through that, is that we know it's not okay, but what we're saying is that with the vaccines, with the Regeneron, what we're going to start seeing eventually, because again, in the beginning, when we first started having COVID, it slowly climbed up, and then it started shooting up, and soon to follow was the hospitalizations and the deaths. And then once the infection rate started dropping, it takes a time for the deaths and the hospitalizations to also drop, because you still have a huge number of people that are infected. And until the infection starts going down, the deaths and hospitalizations remain stable. But once you start seeing the infection rate going down, soon to follow will be the deaths, and soon to follow will be the hospitalization. But it's never okay. It's to have somebody get severely ill, to see people severely ill. I mean, I see it because I'm a hospitalist. I still see people that get sick, but not at the amount that the nurses up at the hospitals see it. And I feel for them, because they're tired and they want this to go away, but it's not going away. I think there's a little bit of a light at the end of the tunnel, unless COVID then changes again and mutates and the stuff that we have available doesn't work. And that will happen if people continue not to practice things that we talked about earlier, not to get vaccinated. It will happen because people will get sick. And the more people that get sick, the more likelihood mutations will occur.
I mean, Doc, it's been 9 weeks, right? So I feel like if there was going to be any decline, would it have already happened already? Or at what point do we kind of say, okay, let's try something? Because, I mean, people out here, especially when we had Dr. Berg on, he had talked about the natural immunity. He had said that we can't stop the spread. He called the spread a side thing. And that we're focusing on, like you said, the treatment and the hospitalizations. But 9 weeks in, again, knowing that these positive cases turn into the people that you guys have to treat with the RegenCove, do you think that we, the people, can do anything else, since there's no mandate coming down? Can we do anything else other than wearing the masks, washing our hands? Because I got to say, that's not working.
Actually, it is. I mean, there are studies that will show you that schools, districts in the states that have mandatory masks wearing versus school districts in the states that don't, it's like 4 to 10 times more infection. I mean, but it's still a lot. And again, this Delta variant is very aggressive. and I don't think anybody really anticipated the coronavirus doing this, where it becomes just as, if not more, aggressive than the influenza. Most coronaviruses, it's not as easily spread as influenza, but this Delta variant has become, and I don't think people really anticipated that. And the thing started about, 9 months ago, and this Delta variant is looking for people that are not vaccinated, looking for people that are vaccinated that didn't work, because we do know that 10% of the vaccinated force are not, didn't help them. And then the people that, and that's why we're giving the boosters, the people that are immunosuppressed, that it did help initially, but now it's waning, so they need the third shot or the booster shot, whichever you want to call it. This Delta variant is really aggressive, and it's finding you if you're at a risk, whereas the previous variants were not as effective. So that's why we were seeing a slowdown of infection rates, slowdown of hospitalization. I mean, almost at the hospital, almost got down to where it was, you only had 2 or 3 people with COVID in there. But then when this Delta hit, it was, like I said, it was very, very aggressive. And it's looking for you if you're at any risk of not having immunity.
I just had one more question about RegenCov.
Sorry, Bree. There's like 2 different conversations going on, but I like it that way.
That's okay with me too.
Right
the
on.
The
infusion
more information
center,
we get out, the better.
Amen.
the infusion center in Mingilao. Can people still go to GMH and GRMC, or is infusion center now going to be the only place?
Well, I mean, the problem having the infusion centers at the hospitals was they were already stretched to the thin with the admissions. So then you're tasking them to do something where initially it was an infusion where you had to sit there for half an hour and get the antibodies and then be watched for an hour. And so you were taking valuable people away from taking care of the sick people in the hospitals. So the short answer, yeah, they still can, but we prefer not to. We prefer them to go to the infusion center in Mingilao because it takes a lot of time and a lot of personnel to operate those infusion centers in a place where they don't have that much people to spread all over. They're thin as it is.
Mm-hmm. Okay, so that's kind of like where we're heading, is referring people mainly to Mingilao to lessen the burden of responsibilities at the hospitals.
Yep, and right now it's being operated by the National Guard and Public Health, but in a few days, the FEMA team which came in the past couple of days will take over the operation, and then that will free us and give me time to go away from what I like to do, which is to see patients at public health and also do my job as chief medical officer. Because right now it's kind of hampered by the fact that I have to be at the Regeneron centers in the afternoon. So I have little time to do other stuff. But once the FEMA team starts kicking in, then that will free my afternoons. So I can do other things that I was tasked to do in the beginning.
How long is FEMA going to be here? How long is FEMA going to be here?
A lot of side.
I'm sorry, I didn't hear that.
Yeah, I think he might have hit his mute button. Froze.
Oh, there he is. Oh, yeah. Okay. How long is FEMA going to be here?
They're scheduled to be here for at least a month, but if it warrants, if we show that they're being used, then they can extend the timeline. Right now, they're scheduled for about a month. Mm-hmm. I think 35 days but then if we document that they're being used a lot, we can then have it extended for a few more months.
Mm-hmm. You know, we haven't heard from Chima in a few weeks, and I think the last time we did hear from him, he had mentioned the HHS team, the regional guy that was here. kind of watching and monitoring what we're doing, providing guidance and so forth. Um, can you tell us what their assessment was of how we are responding to COVID?
Again, I just, so a lot of this information I haven't received as of yet. And I'd be glad to answer that question once I get that information. Unfortunately, I don't have that information, so I don't want to say anything until I know a little bit more about what they recommended, how we're doing, and so forth.
Okay, no problem.
Doc, can you tell us, are we giving out the oximeters now to COVID positives?
Not to my knowledge. I don't, that's a different aspect of, and I'm not too sure whether that's being done. I'm supposed to be attending every morning the updates with the governor, but because of the having to do Teason in the morning and the general in the afternoon, I really don't have much time to do it. So I don't have that information, and I apologize that I don't.
No worries. No, Doc, we get it. You're doing the job. I just wanted to share a story. A friend of mine's father was one of these recent COVID-19 related fatalities, and it all started. He's an elderly man, I want to say over 70, usually works in the garden at the house, and there was a couple days there where the family had noticed that, wow, what's up with Pop? He's not out in the garden. They said he was feeling lethargic, but otherwise seemed, pretty normal. And so after a couple of days of this, they got really concerned, called the ambulance. When they checked his oxygen level, I guess with the pulse oximeter, it was 70. And so he was then admitted to Guam Memorial Hospital, spent some days on the ventilator, and then sadly didn't make it, through the weekend. So here's an example where we have these instances where it's exactly what you guys talk about, the silent hypoxia, right? And the need was stressed a few weeks ago in the press conference with Dr. Mike Cruz about going out and getting these oximeters. And I don't know that we have any left on the island, because I posted a picture of one on my Instagram and everyone was like, where'd you get it? Where'd you get it? There aren't any. And so someone had brought up that this was maybe something that we could have used the American Rescue Plan funding for, was to get some of these oximeters in the hand, because obviously that's a pretty big tool. If we're seeing all these dead on arrivals, people suffocating to death basically without even knowing it, it kind of seems like those little devices could really help a lot of people out and maybe even possibly save lives.
Well, I'll definitely look into that to see if we are and where we are at that stage. But it kind of points out to another thing that I want to stress too, is that, and the medical community has mentioned this, is that with COVID-19, don't assume anything. If you notice somebody's different, have them checked. They noted that, and in this particular case, Pop wasn't doing his garden work for 2 days. Maybe after the first day, they should have maybe taken him in, because with COVID, you sometimes it doesn't act like it's supposed to act in some particular age range, and so they may not have the cough, they may not have the congestion, they may not have things that will clue you in that they're sick. It's just that they're not as active. So anytime somebody seems to be out of frequency, for a better word, maybe they should be checked to make sure that there's nothing wrong with them. I mean, it's better to know that you're okay than to pass it off and say, "Oh, I'll be fine. It's just a cold. It's just a flu. I'll be okay. I'll go to work. I'll go do this. I'll do that." When in fact you have COVID. So with this one, I would say, if you're not acting normal, not feeling normal, assume it's COVID until proven otherwise.
I guess I just really wanted to ask you about, what's the deal with the CAR score? Should we even be paying attention to this? Because, the numbers are high and the CAR score keeps going low.
Do you know how to do the CAR score, Dr. Bob?
No, sir. I haven't been indoctrinated on the CAR score. That was done by a much more brilliant person than me, Dr. Guerrero.
Come on.
And so I need to, like I said, once I started getting less jobs to do, I could start looking into what it entails. But I'm pretty sure the CAR score does take into fact that the infection rate, the death rate, the hospitalization, the vaccination rates, it takes in consideration to all these things. And you're saying the CAR score is going down, but it's still high. So, I mean, I'm not comfortable until, even though I don't know what the CAR score is, I'm not comfortable until the CAR score is less than 1, which we're far away from that at this point. But yeah, I don't know what the CAR score really entails. I just do know that there was a smart guy that did make up that equation, and it took into consideration a lot of factors.
I don't think it took into consideration vaccination, though, Doc, because it was invented before.
Okay. Again, like I said, I'm just, because I haven't gotten information on what the CAR score includes. So I'm sure you're right. Just tells you that I don't know what's in the CAR score.
Don't even worry about it, Dr. Bob, because Jason Solis is the smartest guy in this room, and he couldn't even figure it out.
No, somebody did figure it out, and he was a pretty smart person. And it's when I get to understand what is in the CAR score and better understand what's going on, I probably could give you a better answer then.
All right.
We won't hold our breath because it'll take a while, right? Seems pretty complicated, Doc. Thanks, Bree. You good?
Yes.
Any more Regen Cove questions?
No. Was there anything else you wanted to get out to the
speak
community?
To the people, Doc.
Yeah.
Again, I can't stress enough things that you already heard and probably tired of hearing, but it's important that everybody continues to wear a mask, continues to practice social distancing, continues to wash their hands well. It does make a big difference. I mean, it may not look that it makes a difference, but it does. And then the other stuff too is like get vaccinated. I know people are scared of it. I mean, I was the first one to get it, and I was scared. I was practically ready to run away, but I kind of felt that, wow, all these people watching, I better stay. But the main reason why I wanted to get it is I think it will afford us the chance to go back to where we can do things like taking your wife out to dinner, going to church, at church, not on TV, hugging, that stuff that's typically island style. The sooner we get all of this done, the better.
All right. Thank you so much for coming on.
You're welcome.
Thank you, Doc.
Have a nice, safe day.
You too.
You too.
And don't forget to wash your hands.
I did twice already in the last
and
hour.
wear your mask.
Gotcha. We're doing that, Doc.
Yep.
We're on
Thank
it.
you.
Appreciate it.
Social distancing.
Got it. Thanks. Right on. Ay.
That's doctor's orders right there.
We had a bunch of comments here. Boris comments, all government-approved ideas have not worked. They just destroy the economy and delay the inevitable. This is not a pandemic of the unvaccinated, as both the unvaccinated and vaccinated can catch the virus and spread the virus. This is a pandemic of the unhealthy, as the virus hits people with diabetes, respiratory issues, heart conditions, and hypertension hardest. If you are in any of those categories, the best thing to do is stay away from others as much as possible. What else do we have here in our comments? Go ahead.
Wow. Bev Tess J. Solis, I appreciate all you do, Doc, especially as a pediatrician, but do you truly go to sleep comfortable knowing the facts of our COVID situations and protecting the governor decision? Because I really don't understand her decisions.
Yeah, Matcha comments, and their plan is just making healthcare workers, officials, and volunteers have no break because it's convenient. They will do the work. Bev also comments, I like this comment. Since the Delta variant is aggressive, then make restrictions aggressive also. Chamarita Regis, Chris, you're right. The 3W is not working. Get used to it. You might as well stop the 3Ws and get the COVID.
No, we're not going to stop.
Yeah, and Doc, you know, I know you're still hanging out with the comments, but I'm not saying like wearing masks doesn't work. Obviously, we're all wearing the mask in here. I mean, we were the ones who were yelling "Stay home" at everybody. I'm just saying that has been the message for 9 weeks: is wear your mask, watch your distance, and I just feel like that's not. If we look at the numbers, something's not working, and I just don't know if it's. What is it? Is it the mass? Is it the gathering? Obviously, maybe we'll get more data with Dr. Ann on. Matcha comments, they did not try placing more restrictions in 9 weeks. Fausto says, so what the doctor's saying is the strong will survive and let the weak die. Ooh.
I don't think I said that. I mean, I agree with some of the comments about it, but, again, you got to look at what you're dealing with. If you have 120,000 people vaccinated and 30,000 unvaccinated, and you look at the rate of infection and the rate of hospitalization and the rate, I mean, I didn't even touch the rate of deaths. I mean, yes, there are a couple people that were vaccinated that did die from COVID-19, but overwhelmingly, it's been people that were unvaccinated. I think of the last 20 people that have died, 18 or 19 were unvaccinated and only one. And again, you're looking at 1 out of 120,000 versus 19 out of 30,000. So, it does work. It's not working as fast as people would like to see it work, but it is working. And if people got vaccinated, I think these numbers would definitely be a lot lower. Again, 1 out of 120,000 people died that were vaccinated in the past 2 weeks. 18 or 19 unvaccinated out of what, 30,000? So if you look at the numbers, you'll say, I mean, there's obviously it does work, but it doesn't work as fast because unfortunately we still have people that refuse to vaccinate. Even though you say people about wearing masks and social distancing, there are a lot of people out there that are not doing that. I mean, they have parties, and they don't wear masks. The majority of people who are vaccinated wear masks. They're not having problems with COVID. Whereas the people that are unvaccinated, not following the social distancing and the mask wearing and the hand washing, more percentage-wise of those people get sick. More percentage-wise of those people get hospitalized. More percentage-wise of those people, unfortunately, pass away from the COVID-19.
But how much of these people that are passing away, because they seem like they're elderly, are getting sick because of maybe younger people in their household that are out and about and coming home and infecting their grandma or their grandpa?
And that's the message I give to them. I said, look, some of these COVID infections are silent, meaning they're asymptomatic, but you're spreading it. I mean, I always leave when I talk to parents about kids and that, because prevention is a big thing. I said, if you really want to protect your parents, if you really want to protect people around you, then take the appropriate action, and that is get vaccinated. I mean, for those people that are asymptomatic, it doesn't make, if you look at it, it doesn't make sense to get vaccinated because they didn't have any symptoms. But that's not the problem. The problem is that you can spread it to people that can have with the virus. So again, if you want to protect your parents, you want to protect your grandparents, get vaccinated. Because you're right. It's the studies show it's the 20 to 40-year-olds that are spreading this disease more.
Yeah. Doc,
they may not be the sickest, but they're spreading it.
Right, yeah. Just going back to prevention, right? When we had Dr. Berg on and this whole idea of just letting the virus run its course popped up in that interview, I know that there were some pretty high-ranking Saipan health officials listening to that interview, and they were just like mind-boggled that the message wasn't more about prevention, which you just had mentioned, that the message appeared to be that we can't stop the spread. So again, just going back to the prevention side of it, other than, wearing the masks and doing what, we feel people kind of have been doing, is there anything else we could do?
Just keep on keeping what we say true to your heart. I mean, the last pandemic was and the one in 19, it took 4 years before it was back down to normal. We're in year one, basically, a year and a half, and I'm pretty sure it's going to be a lot less than 4 or 5 years before it's back to normal. So we gotta have people doing things that are appropriate. I mean, even the pandemic of 1918 showed, when it was the end of the First World War, there were 2 cities, St. Louis and Philadelphia. One had a parade for the veterans that were coming back, and Philadelphia was hit tremendously by the amount of influenza that went out during that time, soon after that parade, whereas St. Louis didn't do it, and they continued to have influenza, but not at the rate that Philadelphia did at the time. So, social distancing and hand washing, they do make a big difference. Unfortunately, if we have people that do hand wash and social distance, they don't get sick, and we don't see that. But we do see people that do get sick, and they probably weren't doing those things that were common sense things because they didn't think it was necessary.
Right, so I know you maintain that wearing the mask and practicing social distancing, washing your hands is working, right?
Yes, ma'am.
Right, so it's been several weeks already with this. Well, I'm talking about with the separation of the vaxxed and the unvaxxed. We're still seeing a lot of cases, triple-digit cases. So, is that really working?
Yes, ma'am. If we didn't have the people that were vaccinated, again, you look at the numbers. If those 120,000 people that were vaccinated weren't vaccinated, you wouldn't be talking about 100 people getting sick per day. You'd be talking in the thousands. So it does help. It does work. But unfortunately, not everybody's following those common sense things. And that's where we get ourselves into trouble.
So do you foresee us keeping this separation where if you're unvaxxed, no, you can't go to the restaurant, no, you can't go to the fitness centers, and we're just going to keep doing this until they get sick and get immunity from that or get the vaccines? I mean, that's going to happen. If you're unvaccinated, you're at risk of spreading it, because a lot of times, like I said, a lot of these infections are silent. You don't have symptoms, but you can still spread it. And the factor is that if you're vaccinated, you're less likely to get sick. If you're less likely to get sick, you're less likely to spread it. So, I do believe it's necessary to do these things, because unfortunately, for whatever reason, people, and I think that's a thing that we need to do, is be better at spreading this information about vaccines, better at spreading the information. I mean, to most people, we're doing it, but not all people are following that. And that's the problem. We got to convince those that are not following it. We got to find out why they believe it doesn't work, why they believe it doesn't help, so that we can reason with these people, for those people that not vaccinated or not following the hand washing and wearing a mask. Try to convince them, find out why they feel that it's not helping, and try to give arguments to help them decide what I believe is the right thing to do. We got to be better at our job.
Amen.
I mean, we're doing a very good job, but we still got to get better.
All right. Don't let your guard down.
Thank you, Doc.
You're welcome.
I appreciate your time. Just look at it this way. At least you didn't have to rush over to the infusion clinic right away. Got the little change of pace.
In the afternoon. I have to rush over to.
We're gonna start an afternoon show then to give you a little break, Doc.
I have to rush over to Teason.
Okay, take it easy, huh?
All right.
That's the.
All righty.
Okay, let's keep it going. Let's go into the Zoom room now where we have the Board of Education Chairman, Mr. Mark Mendiola, and we'll unpack the interview there with Doc coming up in a bit. Hi, Mr. Chair.
Unmute.
Half a day. Good morning.
Good
Hope everybody's
morning.
Okay.
Hey.